Happy Valentine's Day. We've got a special program for you.
That's right. We are talking heart health today with experts from Intermountain Medical Center. We're joined now by Dr. Benjamin Horne, a researcher from the IMC Heart Institute. Tell us how important heart health is.
Well, heart health, this is, of course, is Heart Health Month, and today we're talking about our hearts, and it's so important. For women in particular, we need to get out the message that there are 6 times as many women who die of heart disease than breast cancer, and it's just a plague for men and women. But
now, what do you attribute that to? Why so much in women?
It's just heart disease is very widespread and causes morbidity and mortality in just most people in the population. It's the #1 killer.
Now, is the #1 killer of women? That is so profound. First of all, that it takes that many lives.
And there's some of the symptoms that are different in women, and most of the risk factors are similar, but you have to know what your values are, and it's not been ingrained in our culture
now, is it hereditary?
As much as men. There is some hereditary effect, and that's something that you should know, your family history. Talk to your family members when you get together on holidays and find out what they have.
So, Dr. Horne, we know family history is important. What else should people be doing to take care of their hearts?
They should be knowing what their blood pressure is. That's a silent killer. It's not something you feel when you have high blood pressure. Know your cholesterol. Stop smoking. Be physically active and eat a good diet.
All right, now let's talk about a trial, because you've got something that's kind of cool coming up where you're looking for some help.
So we're looking at reducing some of the cardiac risk factors, and in this trial in particular, it's a study of intermittent fasting. We're looking at reducing cholesterol levels as well as blood pressure and other factors. And we're looking for individuals to participate who are willing to fast for 24 hours once a week for 6 months. And to participate, some of them will be randomized, half of them to a normal diet, so they won't be fasting, but we want them to participate and see if intermittent fasting is something that's a non-therapeutic, non-medical method for reducing cholesterol.
And it's called the Wonderful Trial. So how can people sign up?
People can call us at 801-507-4898. We're looking for individuals who are not taking a statin medication to lower their cholesterol, who have modestly high cholesterol, 90 milligrams per deciliter or higher, and have one other cardiac risk factor, whether it's high blood pressure, diabetes or prediabetes, or obesity.
Now, is there compensation that goes along with this?
There's no compensation other than the fact that you might lose a little weight and improve your health, improve your cardiac risk factors.
And help out with some great information, and that's what it's all about, is trying to get ahead of it. We always want to be preventative before we have to fix it.
That's right. That's right. We want to prevent the disease. It lowers the costs. This is something that doesn't cost you anything to fast, and it also improves your health, and it makes it so that you don't have those problems as you age that the heart disease brings on.
All right, Dr. Horne, thank you so much. And we do have some important numbers we want to share with you right now. For more information, you can always go to KUTV.com. Hashtag on Twitter, KUTV Ask the Expert, and then this number right here, you can call this.
Heart health people are standing by right now, 1-877-908-0680. People are stopping by, and they're ready to take your calls.